Thank you, Michelle. So welcome everyone to the September meeting of the Health and Wellbeing Board, being held in the Council Chamber at Guildhall in Shrewsbury. This meeting is being live streamed and recorded. Members of the public will be able to see this meeting and hear the audio. So I'd like to go from my left to right, please, and ask for those present to introduce themselves, their role and the organisation that they represent. So I'm Bernie Bentic. I'm the portfolio for health and public protection at Shropshire Council.
Rachel Robinson, Executive Director of Public Health, Shropshire Council.
Morning everybody, Simon Whitehouse, Co-Chair of the Health and Wellbeing Board and Chief Exec of NHS Shropshire, Telford and Wrekin.
Good morning, Claire Parker, Director of Strategy and Development for NHS Shropshire, Telford and Wrekin.
Lynn Corley, Chief Officer, Health Work Shropshire.
Vanessa Watley, Chief Nursing Officer, NHS Shropshire, Telford and Wrekin, ICB.
Good morning, Gareth Wright. I'm the Deputy Director. Goodness, just hang on a moment, please.
Could you just...
Could I ask everybody to switch the sound off on their laptops, as this may be the cause of the problem.
The echoes now.
So thank you. Can we resume?
Good morning, Gareth Wright. I'm the Deputy Director of Operations for Urgent and Emergency Care at NHS STW.
Morning, David Crosby, Chief Officer for Partners in Care with a member of the Association for Care Providers in Shropshire and Telford and Wrekin.
Good morning, Carla Bickley, Associate Director of Strategy and Partnerships at Shrewsbury, Telford Hospitals.
Good morning, my name's Nigel Lee. I'm the Director of Strategy and Partnerships at SAS and Chief Strategy Officer for NHS Shropshire, Telford and Wrekin.
Good morning, Tanya Miles, Exec Director and Director for Adult Social Care for Shropshire Council.
Good morning, Councillor Ruth Houghton, Councillor for Bishop's Castle and the portfolio holder for Social Care, Adults and Children.
Good morning, Hannah Thomas, Community Wellbeing Outreach Team Manager for Public Health Shropshire Council.
Good morning, Amanda Cheeseman, Shropshire Council Public Health Development Officer.
Michelle Dulson, Committee Officer for Shropshire Council.
Louisa Jones, Business Support Lead for Partnerships, Shropshire Council.
Thank you, ladies and gentlemen. Can I ask those who are online to advise us of their name, role and organisation, starting please with Teams live event. Okay, so moving on, Laura Fisher, please.
Good morning, everybody. Laura Fisher, Head of Housing, Resettlement, Independent Living at Shropshire Council.
Thank you, Laura. Mark Trenfield.
Hello, Mark Trenfield, Public Health Intelligence Analyst, Shropshire Council.
Thank you. Ben Hollands.
Ben Hollands, Midlands Partnership Foundations Trust, and I'm the Senior Public Health Manager there.
Thank you, Ben. And Andy Hall.
Good morning, Andy Hall, Portfolio Holder for Children and Education, Shropshire Council.
Thanks, everybody. So apologies have been received from Superintendent James Dunn, West Mercia Police, and Councillor Heather Kidd, Leader of Shropshire Council. I'd like to move on to disclosable pecuniary interests. Can I ask, please, if there are any members present who have any pecuniary interests not already recorded in the Register of Interests to leave the meeting prior to those items being discussed? Thank you. And so if we can move on now to the minutes of the last meeting. Can I ask, are there any amendments that anyone would like to make to the minutes of the last meeting? No, thank you. So I'd like to move that the minutes of the Health and Wellbeing Board meeting held on the 19th of June 2025 be signed as a correct record. Can I ask for a seconder, please? Thank you, Simon. And so can I ask for those in favour, please? Those members of the board. Thank you. Any against? And any abstentions? Thank you. That was unanimous. There were no public questions received, and so we'll be moving on to the main agenda. And this will start with the winter preparedness and wellbeing overview, which will be received for comment and is being presented by Gareth Wright, Deputy Director of Operations for Urgent and Emergency Care. Thank you.
Thank you. I'm just connecting to the Teams channel so that I can present a couple of slides in the authentication. Okay, I think the slides are there. I'm going to brief from just two other slides. The same brief to the Telford and Wrekin Health and Wellbeing Board this afternoon. Just before I start, our winter plan has been assured by NHS England in two events that have taken place this month. Firstly, a winter assurance visit by senior leaders from the NHS Midlands team, and yesterday we took part in a region-wide stress test exercise, as was described, which assured the collective of our integrated care systems across the region. So I shall move on to this slide. Is intentionally blank, so I'm going to build on it. What I'm going to describe are the elements of our plan and how we've got to where we are now and where we're about to go next. So just to orientate to this background, we've got time blocks along the top, which aren't quite even. Then we've got three levels. There's the national regional perspective, our system planning, and then our system delivery. So firstly, a point I'd like to make is that we are all nationally much further ahead in our winter planning than we were last year. The change of government last year delayed planning somewhat while the new administration in London decided how they wanted to approach winter. So we're approximately 2 months ahead of where we were last year, which is really welcome for us. It means we're in a much better place to now adjust and finalise before the winter months come to us. The direction we've had from NHS England this year has been much earlier, but it's also been much more prescriptive and detailed. And actually that has been quite helpful to us to align our preparedness. And then at point 2 on this slide, the NHSE assurance process this month. We've ticked off the first of those 2 bullets as I described in the title slide. The final point is our board assurance statement that we'll be submitting if our board is content with the winter plan next week on the 24th. And the plan in full has been shared with the board for information and for any comments that you may have, which we would then be able to take into board next week. So how we've approached it, our own winter planning started before last winter finished, to be honest. We made a start on this in March while we were still experiencing the winter pressures, which actually continued into April this year. It was a pretty high demand month for us on our hospitals. So seamlessly from last winter, we've been planning for the next one. We've built it into our system-wide improvement programme, and that's been running now since the 1st of April. So the key thing that we are going to do to get ourselves ready for winter is delivery of a number of programmes of change that we are making in our system. And this will set conditions for a much stronger entry to winter for us than we achieved last year. Examples of that are the modular build, which is taking place at the Royal Shrewsbury Hospital. That should be completed by the start of December. We're changing the way that Shropcom deliver community services into an integrated out-of-hospital model, and we are changing the provider contract for our single point of access that helps to find alternatives to the emergency department, including for ambulance crews to consult them to see if there's an alternative to taking somebody in. So by delivering all of those programs of work, we'll get ourselves in a much stronger footing. And those programs will be enduring beyond Christmas, that they're not specific for winter. And once we've made those changes, we'll have them in the years ahead. So that will help our resilience of our pathway in the round going forward. So next, our winter response, and I'll unpack this box on the second slide that I'm going to use. But the point that we're keeping a really close eye on at point 5 at the bottom of the slide, the festive fortnight, as we've described it, effectively has 2 4-day weekends in it, which we've got to be particularly wary of, because inevitably our staff and partners will want some downtime over the Christmas and New Year period, but we've got to make sure that we've got enough staff available to cover everything that we need, and we also need to create ourselves some headroom ahead of that period, and then be prepared to step out of it strongly afterwards. So we're keeping a really close eye on that period to make sure we get that right. And then we're going to have a phased response, which I'll unpack on the next slide, so I won't expand on that box at point 6 at the moment. All of this is in the context of the national reset of NHS England and our ICB clustering. That will inevitably be a bit disruptive to our command and control overall, but we will make sure that we manage that effectively, and our providers of healthcare won't notice any disruption there. We will make sure of that. But also at point 8 there, it's really important that we step out the window strongly, and so we will, as we did this year, design our improvement programme of work for the next financial year so that we can launch that from the 1st of April and hit the ground running again, having learned from the winter experience. So just a bit more about our winter response, the blue box at the bottom. There are 5 stages to how we're going to approach it. We're going to deliver our programs as described in the previous slide. And then the main aim for us in November, December is to reduce that rising pressure that can overmatch our capacity. Last year, there was an earlier onset of flu across the region. It was much higher and it lasted longer than had been predicted. So we will have a really intensive system-wide effort to reduce that pressure. And as we approach that festive fortnight that I highlighted in the previous slide, we want to make sure that we have capacity and we have space in our hospitals to absorb the demand over that period. Then we'll go into a period of recovery, having consumed capacity. Our priority then will be to decompress and then to rebuild that reserve of space. We'll sustain that through February and March, and then transition from winter, tapering off our winter schemes that we're going to enact. This year, some of our schemes ended on the same day. I mean, we'd put extra transport into the acute trusts. We had some external support from the British Red Cross, and when they stopped, we really noticed the difference. And so we're going to taper them this year rather than doing them at the same time. But just two other points I want to make. Firstly, I've put 3 bullets top left on this slide. We in our mind have really clear system objectives. We want to enter winter into the best position that we can, and by delivering our programs of work, we believe we can do that. We want to make sure that we're not overmatched by pressure, by regulating and effective command and control over our system. And then we want to make sure that we exit winter on solid footing so we can step forward. So how we're going to do that, we've got the 3 categories I've put down there of additional schemes. There are the enduring high impact improvement programs, which I've described. We're going to put in place a number of seasonal specific measures which we're funding from the ICB, notwithstanding how tight the finances are. It's judged important to us that we do that, and that will help us reduce that rising pressure and ease overall. And then we're going to have a handful of responsive actions in hand that we can enact if the pressure is building beyond what our enduring and seasonal interventions will counter. An example of that would be we may put on some extra transport if we need it to discharge patients home. We're working with general practice to see if we could put an extra GP into perhaps one of our minor injuries units, or to generate more capacity in community pharmacy and in primary care. So we believe with that range of measures available to us, we can deliver what we're setting out to do on the bottom of the slide here. That's what I was going to cover, Councillor, for the by way of brief. I would happy to take questions now, but I know there are 2 other items within the winter agenda item.
Thank you very much, Gareth. I wonder if I could start off the questions by asking first just some brief detail of the stress test that the system underwent recently, and what were the main outcomes and any learning points that you had?
Yeah, certainly. This is the stress test exercise is a nationally directed and supported exercise that's been delivered at regional level, and we met with the 10 other care systems across the Midlands region yesterday. It was an exercise format that started with baseline pressures, then it added on what's described as surge pressures, which includes higher prevalence of respiratory illness, higher patient demand. Then there was a third step in the process, which was described as super surge, which included scenarios of perhaps multiple respiratory illnesses, colder weather, including higher falls and cold injuries from our patients. So we ran through a series of injects to that as a system group with NHSC oversight. We responded with plans that we've got, how we would approach it, how we would counter it. The principal learning I think we took from it yesterday, other than being assured by NHSC in that process, was the need for us just to revisit all the contingency plans that we have from experience of incidents that we've had in the past. So that might include flooding, might include an IT outage in one of our hospitals. And the important thing for us is that may happen concurrently with these extra winter pressures that we're going to get. So we need to make sure that we can manage those concurrently and effectively.
Thank you very much. And if you wouldn't mind, just one more question before we open it out to the floor, and that is that you've stressed that respiratory illness is a critical part of the winter pressures that are felt, and it's clearly vaccination is a vital part of that. Can I ask if there's been any increase or any change in the communications, and particularly the advertisement of vaccination programs in the lead up to the autumn, and also when the vaccines are expected to arrive, if you know that?
That's actually the next section of the agenda item.
I'm just asking for your perception.
Yeah, we are going to we're going to do, as we did last year, which with success, was a system-wide communications campaign for winter. That will include think which service to inform and empower patients to make a decision on where to go for the right care, pharmacy first, and also the importance of vaccination. That's the sort of three main pillars of that comms campaign that we're going to launch.
Thank you. They've been made public in the public arena.
It will, very much so. It's absolutely aimed at the public. We're going to, using what worked for us last year, a broad spectrum campaign, including social media. We'll have radio adverts. We will print leaflets. We'll have pharmacy bags with the print on. It's a really broad spectrum campaign that we're going to enact.
Thank you very much. So open now to questions from the floor. Is anybody else? Any questions on this item? Okay, well, sorry, yes, Tanya.
Thank you, Chair. So thank you very much. It's great to have the plan in advance, 2 months in advance. So very well done to this system, who I know always work so hard over the winter period and have learnt loads by the winter of last year. Just one kind of comment. The report very much reads around the vaccination thumbs up. We know that our residents of Shropshire really welcome the kind of vaccination programme. Last winter, we ran some really good clinics in some of the GP practices to do with flu and respiratory, which was really well received by our residents as a way of preventing the need to go into A&E. I don't see that in the report. Is that something that's happening that's somewhere else? And I'm sure there are lots of things happening that may not be in this report cited, but I think for the residents of Shropshire, they would like to see some really simple messages around what we're doing as a system in terms of prevention, which is not just about vaccination, but if you're unwell, where you can get easy access to your GP. And I know the respiratory flu clinics was a real success for our residents. And I guess the comment that I need to make, and you expect me to say this from a local authority perspective, last Wednesday, this cabinet declared a financial emergency. So I need to put on record our concern around the lack of national funding to support the Shropshire system in terms of winter. Thank you.
Thank you, Tanya. Any other questions or comments?
Could I just answer the point about the respiratory illness clinics? We absolutely are going to repeat that this year, Tanya. The Shrewsbury PCN have been leading the way on that with Dr. Charlotte Hart. Part of the reason why we haven't broken cover on that is we put in a bid for some national funding, which we should get the results of on Friday. If we do get that, that would help us to strongly expand our scale of effort across other PCNs as well. So we're cautiously optimistic that we're still in the hunt for that. But regardless, we'll be supporting some practices from our system funding allocation this year to repeat it.
Thank you, Gareth. Can I just make a comment that not all practices this year are participating in the vaccination programme, and so it's clearly vitally important for the public to know exactly where to be able to go for their vaccinations. Nigel.
I think it was just to reiterate a point, and it kind of links to Tanya's question as well, and to Gareth's point. I think it is very easy and it's correct to make sure that we focus on the hospitals and what other NHS partners, particularly NHS trusts, do. But the work that Gareth and colleagues have been doing has been massively supported by all partners across the system, and the different parts of primary care and obviously general practice is fundamental. But Gareth mentioned pharmacy and others. That they are absolutely part and parcel of the partnership to develop the the plan. Yes, of course, across the 12 months of the year, but especially as we approach the winter period. So I just wanted to assure colleagues and the Health and Wellbeing Board that it is very much a joint effort across all partners, and that does indeed include both local authorities as well. So thank you.
Thank you, Nigel. Ruth.
Thank you, Chair. I'd just like to comment and ask a question around the use of pharmacies and the messaging around pharmacy first. There has been some evidence around some sort of spots in rural areas, particularly where there is more limited access to pharmacies. And I'm wondering if there's any scope to provide additional hours and where there are pharmacies, so that in times of bad weather during the winter, that people in rural areas still have access.
Thank you. I don't think we have a pharmacy representative today, but perhaps Rachel might have a comment. Do you have any?
Sorry, I certainly think, I mean, I don't know if any colleagues want to comment. If Gareth has got any updates, that might be a better place to answer, but we can certainly take that away.
It is an issue we're conscious of, and some of the, I believe I'm right in saying we have 11 of our practices in county who are prescribing and dispensing practices, some of which are focused on the covering for the rurality where we don't have community pharmacies. But as Rachel said, I will talk to our chief pharmacist about that and just make sure we keep that in mind as we progress.
Thank you. And Nigel, is part of the hospitals system. Can you advise what the secondary care providers have been doing with their own staff to ensure that vaccination levels are high?
Yes, absolutely. And ironically, we've got our staff cascade at lunchtime today, which is chaired by Joe Williams. So vaccination, we've already had a number of different internal communications about that through particularly the clinical divisions, but actually across all. That campaign will start. And you mentioned, Chair, the point around the provision of the appropriate vaccine. Obviously, that's a factor that we just need to take into account. We expect that, certainly from a hospital perspective, the planning is end of September, beginning of October, that will be in place. So our internal staff vaccination campaign will start in earnest in October. We've already been building the internal capability to make sure that we've got lots of peer vaccinators, and our chief nurse is leading the programme. She herself is a vaccinator. She's already lined up all of the board for their flu vaccine as soon as it's available.
That's heartening to hear, and I was particularly pleased when West Midlands Ambulance Service reported that they had over 90% vaccination of their staff last winter. Thank you. So are there any other comments? If not, thank you very much, everybody. And so we'll move on to the vaccination improvement plan. Sorry to preempt your presentation, Rachel, but if you could let us know what we're planning from a public health point of view. Thank you.
So this is actually, and I should have said it in my introduction, I think she was full distracted, I need to change my name label. So I actually am a joint appointment, so I am the Director of Public Health for Shropshire, across Shropshire, but I work jointly across Shropshire Council and the ICB, and this is one of the joint pieces of work that we're doing as a system. This is our system vaccination improvement plan. I know and naturally segues from some of the conversations we're having around winter planning. Obviously, a really important part of the winter planning, as colleagues have already said around the room, and a really important role for this Health and Wellbeing Board is improving vaccination uptake, not just winter vaccines, but all vaccination programmes. There's a really quick preventable thing that we can all do, and we can all support as members of the public, as health professionals, as we've discussed, to really help manage and prevent the escalation around, particularly around winter, but for many illnesses throughout the year. So what we've done as a system is we've come together. We have a vaccination improvement plan. It is in draft. We actually have got conversations with NHS England this afternoon, again around this, that kind of ongoing conversation, because it's a complex procurement, commissioning, all of that process around vaccinations. If you think about the number of vaccinations, the number of providers, etc. What we have is a vaccination improvement plan that will be going to SHIP. As well, that we've come together as a system to discuss. I'm not going to go through all of it, and there's some slides that I've got here that we'll send out after, so colleagues can go through those. We're really interested in getting feedback, because we see as one of the critical roles of both health and wellbeing boards is to help us to promote, get these messages to all of our communities and all of our staff. The programme have a couple of elements. So, and you can see that in here. What we were going to pick up today particularly is around just understanding the current position. It's really important that we know where we are in terms of our uptake of all of our vaccinations, but also where we're aiming to get to as well, which is an improvement. The other bit that's really important, as I've said, for this board to be aware of, is the communications and engagement, making sure that we reach as many people as possible, and really interested and support of having as much information to build on the good work we've done previously. We want to get this as far and as wide as possible. So feedback on that's welcome. And of course, as a board, we're particularly interested in inequality. So not just, we've been very successful from COVID and before that, in terms of reaching some of our communities who perhaps wouldn't want to engage with the vaccination program for a number of reasons, and trying different approaches to get to those communities. And that will continue through this year. I'm not going to go through this in detail, but as I said, these will come out just to reassure the board that there's a great bit of work being done by colleagues in the ICB to bring together the vaccination data. So we'll have a dashboard that we can monitor, that we'll be bringing back to regular meetings. So internal meetings, as I said, we've established, or perhaps I didn't say, a vaccination group across the system. All partners are involved, including NHS England, to make sure that we're coordinating this programme, and we're keeping a very close eye on the response that we have around vaccinations. First part of that is to actually understand what you're aiming for and what our data is. So there's some great work being done by colleagues, analysts at the ICB, to bring together some dashboards. And just to give you a little bit of an overview around that, what we've collected is look at some of the figures around flu, where we are. So about 72% last year we were in terms of flu uptake across, obviously there's lots of different cohorts. COVID rates had fallen. So again, how do we push those rates? And obviously we've got slightly different cohorts in terms of some of those programmes, and RSV rates. When you bring those all together, again, we had some work to do in terms of those uptake. Same with staff. We've already mentioned the importance, you can see over there in the corner, the staff vaccination rates. We really want to push that this year and maximise output, learning on good practice from other areas. I'm not going to go through these slides, they'll come out to you, but what we're basically saying here is that we've got some targets that have been set for us. We absolutely want to achieve those targets, but we'll be looking to stretch those and go beyond. And what these tables show you is where we've been able to achieve targets, bearing in mind overall Shropshire is higher than other parts of the country, but that doesn't stop us from wanting to go further and beyond that. So there's some uptake rates there that we'll be looking to achieve. You can see there, for example, we've got some groups we'd really want to focus on. We're quite good in areas like care homes, and we absolutely want to keep on top of that. But there's other groups, particularly our at-risk population, our pregnant mums, and obviously our over 65s, and particularly some of our young children as well, that we really want to make sure in terms of flu that we're getting, and we're using all of our routes through our schools and others to make sure we maximise that uptake. The team have been doing some great work, and again, I won't go through all this now, but it will come out in terms of inequalities and some of the groups that we may need to target work with. So we've got some really helpful information here around populations we want to work with. It's not really surprising, there are more deprived communities, some of our minority communities, and then we've got some particular conditions where we're not seeing people having as good an uptake. So some of those chronic diseases and respiratory diseases, where we absolutely want to make sure that everybody's, people are more at risk and they have those vaccines. So that's flu. Similar for COVID, really want to look at increasing that uptake in terms of for COVID, again, across the board. And again, we've got similar figures around that. So and finally, the RSV, we really, particularly this winter, want to have a real push on making sure we get the numbers up in terms of RSV. And again, just this is demonstrating some of that data that we've got that allows us to be able to target the work. So as well as doing campaigns universally, we'll be using that to target social media. And again, we'd be welcoming input from partners to really start pushing those messages out. So I'm not going to go through all of these, but these will be circulated to everybody and they'll be uploaded so everybody can see those, the public can see those as well. What I just wanted to talk about then is, and it's already been picked up, so I won't spend too long on it, is the vaccination and communications plan that's in place, building on the work in previous years. And we've had some really successful work in previous years. In COVID last year, we really want to push our comms and engagement. We want to look at how members and in terms of our local councillors, how our communities can really support us to push our engagement. So obviously our overall aim here is to increase uptake in all groups and target work where we need to. There's a number of things that are in this pack that talk about just some of the key messages that we're going to be trying to push. So your vaccination, booking, early booking. There's some really important positive messages in here. I'm not going to go through them all, but just so you can show the work that we've been doing in the background to pull together the comms plan, which we'll be launching from now. We'll be starting to push these messages out and we're looking for input into that. The final thing just to talk about briefly and to give the board some assurance around, as I said, all of this is going to go through to SHIP next month to be discussed in detail, but obviously timing wise it's really important that we start to land messages now around vaccinations. One of the other really important things that we've been doing is around inequalities. We had some funding last year around HPV and MMR. The MMR we've talked about at this board is really important that we still continue to push that. And so we do have some resources still left over where we'll be pushing messages around making sure that we get that we get our children and young people vaccinated, particularly thinking about some of the outbreaks that we've been having across the region. The other important bit then is we will be putting, and we have put together a bid that the group working collaboratively using the data that's been shown across this whole system, so working closely with Telford and Wrekin to do some targeted work around winter vaccination. That will include education, so working with particular groups, understanding what the barriers might be for certain groups, and then making sure we've got education and literacy, and then those pop-up clinics in particular locations, which make it more accessible for people to reach some of those services. So that is a piece of work that we are looking to, there's some funding there, we're looking to for confirmation of that funding, and then we'll be looking to roll that out over the next few months. Just the final slide is just a governance one, just so we see the roles of both Health and Wellbeing Board and SHIP as critical in helping us deliver, particularly the comms messages and the inequalities aspects of this. So we'll be bringing regular reports back through SHIP, and obviously we can share updates in terms of the data dashboard and in terms of progress. But I guess we will welcome. We'll share the slides more broadly in terms of the campaign. We've talked about some of that work that's already started and will start. And I guess what we really want to do is make sure that we're promoting those messages and getting those out in support from partners across the system. Vanessa might want to, I just wanted to pick up the other point as well around GP practices, just to mention that all GP practices are providing flu and RSV. It's COVID where I think there's that's not quite the case. So, but I'll just wanted to kind of clarify that, so particularly for the public and other colleagues. But I'll let Vanessa, because we're working on this collectively and jointly.
Thank you very much, Rachel. Obviously, a huge amount of work going on, and underlying the importance of moving from treatment to prevention, which, as we know, is one of the core pillars of the 10-year NHS plan. So, Vanessa, would you like to continue?
Well, first of all, can I just thank Rachel very much, because since she's had the joint appointment with us, she's pulled all of this together, which is really, really important work. I've been working with Rachel on it, and previously had struggled to have it as coordinated as Rachel has. So I think it's onwards and upwards, really. But I just wanted to reinforce how complicated vaccination is to the general public. There's been a lot of new vaccinations. Childhood vaccinations have changed. There's been new vaccinations introduced to them, and those targeted at the elderly has also changed, and there's been new vaccinations. RSV isn't something that we all know and love like we do flu, for example, and you know, this is really hard for the public to grasp, and I think we've all got a role in really making sure that we help people to find out which vaccines are needed and help with that vaccine hesitancy as well, and the actual facts about vaccine. We are, as Rachel said, really fortunate in Shropshire to have pretty decent vaccination rates in most areas, but there's always room for improvement, and particularly in those maternal vaccinations as well, where people might be naturally more hesitant. So just thank you all for your support really on this agenda. It's really important.
Thank you very much, Vanessa. So first of all, Ruth.
Thank you, Chair, and thank you, Rachel. That was really helpful. Just as a practical point from a member's perspective, in that we are a network across the whole of Shropshire as elected councillors. A sort of comms toolkit on the members' gateway would be really helpful, that we could just go to and pick bits out for regular social media posts and literature. And I do wonder how we engage some of the registered social landlords, who obviously have a lot of access to some very vulnerable people, but people across the county, and to spread that further, please. Thank you.
Thank you very much, Ruth, for your contribution, and underlining the importance of getting the message out as widely as possible, and particularly to those who may not be on social media, or may not be able to access some of the main ways that the vaccine programme is communicated. Yes, well, I mean, I think briefly that it's not free for everybody, but there are vaccines available for purchase, and if you've got detail, that would be great.
If I can just add to that, Chair, that so not all vaccinations are needed for all populations and age groups. So it's really important people know which vaccinations they are. It's the flu one, really, that people of working age without other health conditions can access in their pharmacies, and so it's just about going online really and checking what you're eligible for. I can reinforce that message. Thank you.
Yeah, I think from a medicine registration point of view, from age 50, people are able to purchase particularly flu vaccine.
Yeah, I just think previous winter with flu, and then being on low income and not being able to afford those vaccines. So again, I know people can apply for, on low income, you can get a year's certificate, but a lot of people don't do that just for vaccines, and it's not affordable. But I was just raising the query about people on low income who don't need those, but can be classed as.
Thank you very much, Jackie, and of course we'll be looking at vulnerable groups and those on low incomes to see if we can ensure maximum uptake of the vaccine programme this winter. Any other questions? Rachel, have you got anything to say further about?
No, thank you, Chair. I think just to say that obviously, as we said, we're monitoring this. We'll take it through SHIP and welcome any input into terms of the vaccination plan, any groups that we need to target, any additional outreach work that we need to do. Really welcome input into that, and we'll keep the board updated. And as we always do, we've got a kind of health protection update. We'll keep it updated with figures and monitoring, and we'll take away the comments and the feedback around particularly those targeted messages.
Thanks very much, Rachel. I'm conscious we've spent a lot of time on this topic, but I think it's a crucial topic for the health system moving into the winter. Thank you. So if we can change tack and move on to the winter wellbeing support, including cost of living. So Amanda Cheeseman, Public Health Development Officer at Shropshire Council, and Hannah Thomas, Community Wellbeing Team Manager at Shropshire Council, is going to present. Thank you.
So winter wellbeing support from Shropshire Council and from our voluntary and community sector partners, focusing on cost of living. So this is a very brief taster. Firstly and importantly, there are 3 key messages that we would like everyone to share, please. And that is, if you or someone you know is worried about money or is struggling right now, you are not alone. There may be simple steps that you can take to cut costs or maximise your income. If you are getting into debt or your mental health is suffering, please don't wait to get help. Lou? Yeah, thanks, Lou. We worked in partnership to bring together key resources to ensure that everyone is signposted to the best place to get support in Shropshire. The council hosts the cost of living webpage created with the voluntary and community sector and other partners, which offers information and context, for example, to residents who are worried about money, energy, food and mental health. It's a very good support tool. The voluntary and community sector organisations offer general and specific advice such as debt and benefit support, and this can be accessed online and via telephone and in person. We also have the Household Support Fund from government this year, which is from the 1st of April 25 and will finish on the 31st of March 26. This has funded specific support across our age ranges and across our kind of demographic needs, including welfare support team who can be contacted online and by phone for anybody aged 16 and over. And they can give cash payments and vouchers, support, advice and guidance and signposting. Free school meals for eligible children. Citizens Advice, a benefit support advisor post, which will be delivered in the south of the county as identified by our needs assessments. Hardship grants to those individuals who need support that could be delivered by our community sector organisations, including Community Resource. Direct cash on account payments to those who are in council tax arrears subject to the 20% minimum. That's just a snippet. There is a web page with more information on. Further support is available in person and telephone. As an example, these include energy and fuel advice and support through March's Energy Agency as one exceptional offer of support. Food, including food banks, community meals and food shares. That information can be found at Shropshire Larder, brings all that information together, also offers advice, signposting and where to find in-person support. Free warm spaces to access through our Warm Welcome scheme. Targeted support from our Shropshire Council Community Outreach Wellbeing team. This is very targeted and it meets kind of the needs of our identified more sort of higher risk, maybe those that are less represented communities, for an example, our ethnic minority groups, our farming communities, etc. Social prescribing, which is open to everybody, adults and children across the county. Our community and family hubs where people can access support and signposting information in person. And also Shropshire Local, which is across Shropshire Council and accessible to everybody. Thank you very much.
Thank you. We got the second half, or is that it?
No, that is it. I don't think I've anything to add to that. Thank you, Chair.
Thank you very much, and thank you for the three presentations. And so the board is asked to take the opportunity to comment on the draft SUWT winter plan and asked to promote vaccinations to maximise uptake. All partners are asked to share key costs of living communications when and where possible, and are asked to consider the creating a cost of living section on their website. Thank you. Any final questions or comments before we move on? Tanya.
Thank you, Chair. Really comprehensive packages that Shropshire's now put together in terms of that support to our residents. Just thinking, how do we make sure there's really simple messages are out there for not only our residents but for professionals? So if I'm a pharmacist and I come across somebody who I think would really benefit from one of those schemes, where can I go to quickly? So it's so comprehensive, and obviously we understand a lot of what's just been said, but I think we need to think about how we provide some simple messages out to the people of Shropshire about what it is, how to access it. Have we thought about how we're going to do that?
That's a really good question. Thank you. I mean, we do work on the ground, and we kind of, as a whole collective, again, with our voluntary and community sector, our internal, external colleagues and partners, we sort of make sure that these are on the ground messages and they're accessible to everybody. There are some sort of hard copies that are taken around. we're very much embedded within the communities. We go into the key areas, including community pharmacies, and we also make them aware of what we deliver, the information that's available. So it's kind of that collaborative approach of everybody sharing that, and that's our ask really, you know, from the ground level up. There are also resources that are available for our partners that are on that web page as well, but we're more than happy to sort of send them out and share them far and wide again. But if there are any suggestions, then we're really keen to hear those and take those out, especially when we're sort of on the ground within our communities and with our partners.
Thank you. Rachel, and then Jen.
So I was just going to respond a little bit more to that. I think there's because I think it is really, really difficult. We've obviously talked a lot about the Think campaign for winter, and it obviously focuses it's on particularly on what services, and we talk about what vaccinations. I think people often don't think services, they'll think health services, but actually what we're trying to show here is that there's a whole load of preventative services that will keep people well this winter. So I think there's something just working with our teams to make sure we did this last year, but I'm not sure how in terms of the cost of living, for example, information, how well that was accessed through some of the Think campaign. So I think there's a bit we could take away to really try and push to show there's that kind of wider piece as well. Let's think what we can do for ourselves, not necessarily about services, because I think what we're showing here is there's a huge amount of support available for people. It's just difficult, and then it's using all the mechanisms that we've talked about. So it's, for me, I think that's the benefit of this board. It's everybody behind that, and I think maybe if we take away a bit, and I can speak to the teams around how we make that really clear through the Think campaign, so we all really own it. It isn't just an NHS campaign, and we have pushed these messages, but I'm not sure that it's really landed really simply. So I think if we could take some of that away, work with colleagues, work with partners to make sure that those messages are hitting our patients as well. I'm happy to pick that up and take it away. Yeah, I just think there's more we could do in that space. The other bit is I think this links very strongly to the Hubs programme and the neighbourhood working, because one of the things we've got a lot of data. We're going to come onto it in the JSNA, we're going to come onto it in the neighbourhood working. What we can get better at is really targeting. So actually, when we know we've got people with chronic conditions like we've just shown, actually, how do we get ahead with some of these services? Make sure that they know that the marchers can support, that there's advice that they can get to get help with their fuel, and other things like that. So I think that's, as we get better working together and the neighbourhood working as progresses, that's a real opportunity for us to use our data in that intelligent way.
Thanks very much, Rachel. Jackie.
Having one place where people can back to is great. That simple message is that when we're talking about frailty going into the winter, the two things that are the drivers for inequality with low income is fuel poverty and food poverty, and they're the drivers that are going to make people winter. And I think it's really important that people maximise their income and they don't feel stigmatised about that. And it's really hard. We're heading forward now to cost of living, inflation is steady, but it's actually the food and fuel cost of living that's rising. And there's the one part of the budget that people have, the control of, is that you still have to pay your rent, you still have to pay your bills, because consequences of that. So your food bill and your food bill, it's easy not to eat and not to turn your heating on. So it's really key that simple message, get help as soon as you can, but have that information all in one place for professionals as well. Thank you for the partnership approach that we've had on that the focus has been on evidence and need and on intelligence and understanding that's happened in Shropshire.
Thanks very much, Jackie. Yes.
Thanks, Chair. I suppose just to add to that, and thanks, Jackie, we appreciate all your support with this. And those links are within the presentation as well. So hopefully once that's shared, you'll be able to access them. I think for us, it's about how we connect the ground level of the delivery with those bigger programs that are happening. I think because we have got some really useful resources on the ground, and I think there are people working on the ground sharing these messages, but for us it's how we connect it together. So I think if we can try and take that out of here as well and try and work through how we can do that. I think particularly for my outreach team, I think, you know, they're working really hard on the ground, but I think when they're approached by professionals, it's like, how can we have that conversation to get everyone on the same page, I suppose.
Thank you very much, Hannah. Ruth.
Very quickly, I think getting the resources are there, but getting that message out is the challenge. And I do wonder whether we should just let SARC cover all this information through the town and parish councils, because it's a consistent message then that gets cascaded out to all of them, and to some very remote, very small, you know, just parish meetings, but they're the hard to reach community.
Thanks very much, Ruth. So I'm hearing that communications are absolutely vital, and we're not quite at the point we'd like to be, but striving for that. And perhaps the partners could discuss a coordinating effort to ensure that the whole population is reached by these messages, and that they're aware of what's available to them, so that we can improve the health for all, not just this winter but going forward. And I would like to add an additional resource, and that is the councillors. Local councillors are in touch with their local communities, and if they're kept briefed, and particularly if there are tools that they can use, they can engage with their local residents, with the local social media, and can even more and can ensure that some of those in the population that, or in our residents that are particularly difficult to reach, may receive the information that allows them to avail themselves of these resources. Thank you very much. I think that was a very useful presentation. And so I'd like then to move on to item 6, Healthy Ageing and Frailty Strategy, from Vanessa Watley, Chief Nursing Officer at NHS Shropshire, Telford and Wrekin.
Thank you very much. I've got a few slides, and as Gareth's on the link, he's kindly going to share those
Can I just ask, sorry Vanessa, Gareth, if you're going to share, could you share it from the screen, because it doesn't show on the live screen when you share it from PowerPoint Live. Sorry.
Okay, I will.
Sorry,
just had a notification through from the
technical job. Sorry, Gareth. Yeah. So I'll make a start anyway. So the Healthy Ageing Strategy is here today for you to note and hopefully support for the implementation of. We've already mentioned frailty a number of times. It's a really important subject, and so we have developed a frailty strategy, which we have done with our public and professionals across Shropshire, Telford and Wrekin. As an ICB health strategy. We know both local authorities have already got either plans or strategies in place about ageing well, and some of the support that we've already heard today is in relation to that as well. And we're also aware that frailty can happen at any age. However, the majority is with our older people, and that is the area that we've targeted first. However, a lot of the things that I'm about to say will be a benefit to younger people that are at risk of frailty or have frailty too. First of all, just to point out that frailty is a medical term. It relates very much to that gradual reduction in physical resilience and leaving people really vulnerable to sudden change, which can be devastating and end up as not living in your usual place of residence or in crisis and in hospital. Frailty is multifactorial, and it's a continuum from mild disease to severe. But it is preventable and it's not inevitable, and that is really important for us to realise. But as we've already talked about with our particularly at-risk populations, the core 20 plus 5 population that we talk about as far as inequalities goes are particularly at risk of frailty, and particularly that earlier onset of frailty as well. So we're really keen to address frailty and to ensure that it's a sort of substantial impact and growing impact on health and social care demand is we do something about as early as possible. So we've got an ageing society, no more than in Shropshire. In fact, Shropshire, Telford and Wrekin as an ICB footprint is they're increasing in our number of older people at a higher trajectory than many other parts of the country. And in fact, if we look at Shropshire, it's on its own in isolation, then by 2040 will have risen from 91,000 over 65s to 124,000, and our numbers of over 90s will have doubled. So that's vital that we get ahead of this. The 10-year health plan really helps us with this. Hospital to community, analog to digital, and illness prevention are all highly relevant to the frailty agenda and are all in the strategy. Neighbourhood integrated care teams, as Rachel's previously mentioned, can be really important to prevent people taking multiple trips to hospitals that may be many miles away or very difficult to access from rural locations. And strategies that are building on a skilled workforce. We've previously had very general training around older people, but targeting that workforce and making sure we've got the right skills across a range of professions is really important, as is our planning and our monitoring and prevention of access to the urgent care pathway that Gareth's already mentioned. As far as the delivery of the strategy goes, we're highly dependent on the place-based partnership boards, and both have their, Shropshire has its priority and Telford and Wrekin has a strategy. So we are ahead of the game really there. This is just going back to that point about the increasing numbers of frailty, and I'll leave it in for people's perusal. It's Office of National Statistics item, so I won't dwell on that. But the next item is really about that business case for frailty. So if we do nothing, we will be on the red line and we'll be spending many more millions on really a failure to address this population. If we can stem it, then we will be on the green line, and if we can really halt frailty and really succeed in addressing this, then we'll be on the blue one. So we really do this, to prevent ourselves from just having escalating costs associated with frailty, ensure that we tackle this issue. The strategy talks about a number of ways to do that, and it's very much around a very evidence-based process, which is about educating both the population and and our health and care workers, preventing frailty, so making sure we've got that sort of fit at 50 message going, and we're really driving that through every opportunity that we have, so that people can actually, like they would do something about their pensions at 50, they do something about their fitness as well and their health and well-being. Making sure that we can identify people as they become frail and on that trajectory, and GPs have got an ask to really look at how we risk stratify people with frailty, and we've already done some testing of that, and there's a little working group going on at the moment, making sure that that identifies the right people at that mild, moderate and severe frailty level. And then we manage those so that people that have, particularly those with early onset frailty or mild frailty, can have strategies to help reverse that or prevent it. People with moderate frailty, again, can live well at home with good care planning and strategies, and that people with severe frailty are able to end their lives and their last kind of 1,000 days as they would like to, and die in their preferred place. But throughout this is care, making sure that care is at the point that the person wants it to be, and that we're avoiding those crises. And when we do have crises, we have the planning in place to know what to do for them, rather than every frailty crisis ending up in the emergency department. Underpinning all of this is a local neighbourhood approach and that data-driven and digitally enabled care, so that we can all access a shared care record. We can see that respect form that says the person's end of life wishes, or we can see their frailty crisis plan or care plan all together, and that's across health and social care. We engaged with the strategy
Thank you very much, Vanessa. And so a lot of very important work being done, and clearly this is going to be critical going forward over the next several decades. And so have we any questions or comments from the floor? Thank you, Jackie.
Start the strategy, and think housing is really important. Age well, again, healthy homes, healthy people, and again about low income and affordable exercise is going to be really key in tackling those health inequalities. And also just a point Heather wanted to make was that, yeah, we acknowledge digital exclusion in this strategy, and that's great, but it never goes away, because it's just having people become excluded when their health deteriorates, whether it's mental health, dementia, vision and loss, and being able to use the keyboard. So it's something we've always got to keep in mind, that how we include people with that when they go into
Thank you very much, Jackie, for those two very important messages, which I'm sure we'll take on board. Vanessa.
Yes, thank you. Very good point. And that is where it's really important that we link in with what's going on in our local authorities already. We didn't want to kind of duplicate in the strategy, but we absolutely understand that making sure we've got those connections with housing and the digital exclusion work that's going on through the local authorities is really important. And we'll be looking at that as we deliver the strategy. Thank you.
Thank you very much. And so, Ben Hollands, you've got a question?
Thank you, Chair. It's more of an offer, really. So we've done some work in Staffordshire and Stoke around frailty, of course, as well. with it being such a pressing and universal issue. We've recently concluded a pilot of some digital interventions and support for people with mild frailty, which kind of fits in line with some of the principles you described, Vanessa. We've got an evaluation complete for that. If you're interested, I'll share that with you. Some modestly promising results in there.
That's excellent, thank you. And actually, we were fortunate enough to have somebody from the Staffordshire system seconded into us to help draft the strategy initially, which was really helpful to get that shared learning and gave us a heads up, you know, on what might work. And actually came and I went and visited the Staffordshire Frailty offer as well. So actually, there is a bit of Staffordshire already threaded through this, Ben. So I'd really take you up on your offer. Thank you.
Thanks very much, Vanessa. Any other comments or questions? Ruth first and then David.
Thank you, Chair. It seems to me from this morning so far that there's a sort of a wider comms plan needed around all of these really valuable interventions, early interventions and preventative services. I mean, the Fit at 50, those sort of catchy headlines do resonate with people, and people sort of pick it up and think, yep, that's me, I could do something. And we all know that in January, gym memberships go through the roof, and they last for a couple of months at best, probably. So I think there's something around needing a really detailed common strategy with some key dates around everything we discussed this morning, actually, and where those messages need to land.
Thank you, Ruth, for reinforcing that message. And so, David.
Yeah, apologies I didn't raise these issues last week at TWIP, because this is my second time hearing that, Vanessa. Just a plea, really, just to follow up on conversations I previously had with both yourself and Simon around falls response from social care providers. So we ran a really successful pilot with a small number of care providers funded by the ICB a couple of years ago to distribute specialist lifting cushions and training to care staff. And within that pilot, we saw a 75% reduction in ambulance call-outs to falls responses. So we've submitted a sort of a business case, which actually doesn't come to us. It's to pay for the cushions and the training to equip all care providers across the system, which we think would make a significant contribution to reduction in ambulance call-outs and hospital admissions. So as part of the full strategy, it'd be good to just revisit that.
It was an excellent pilot.
Thank you very much, David. I mean, something that achieves a 75% reduction in incidents, it clearly should be grabbed with open arms.
Yeah, it was a very good pilot, and we're looking at how we can expand that.
Simon.
Thank you, Chair. I mean, just to reinforce, I think really important in terms of the engagement piece and the reach and the approach. So really value, Jackie, your comments in terms of the feedback on that, because we've not always got that right in this space, and so in terms of listening around that and trying then to say how do we go about that differently. So I just want to thank Vanessa and team and colleagues for the work on that. I mean, the two agenda items link together, Chair, colleagues, don't they? So we know during the winter period, those at greatest risk and most vulnerable often also have frailty and will be the ones that will end up in the bed base, in the beds at the hospital, and are exactly the ones that we should be looking after and making sure we've got the right support and the right services so that we can look after them at home. I think the system prioritising this, having a really clear strategic intent of this is what we want to do, this is the focus we want to bring to it, and this is the collective commitment we bring, is really powerful and really important. I think the challenge for all of us and every partner sitting around this table is, how do we make sure what we nod at here and say, yes, this is really important, doesn't then just become a file on a computer somewhere. We actually work really hard to bring it to life, so that actually something that we bring about the change, and we really focus on that. And I think as a Health and Wellbeing Board, I'll be saying the same at the Telford and Wrekin Health and Wellbeing Board this afternoon, there's a challenge for us then to ask to make sure that we're seeing it being brought to life, and that we bring a focus on that.
Thanks very much, Simon. And it sounds as though you're asking for a task and finish group.
No, I'm asking for all, because I think actually it's more important than a task and finish group, because I think every partner needs to bring this strategy to life and be clear what its responsibilities are in terms of taking this forward. And then the Health and Wellbeing Board as a collective should be asking for a focus update coming back to say, actually, what are we all contributing, what's that looking like, and how are we progressing with the implementation of the strategic intent as drafted and as shared with us this morning, Chair.
Thanks very much, Simon. That's some really important points made today, which we'll take away and we'll intend to put into action and hopefully report back soon. So thank you very much for the presentation, Vanessa, and the discussions around the topic, which is of critical importance over the next few decades. And so can we move on now to the Better Care Fund for 25-26 Q1 report and explainer from Jackie Robinson, who's Senior Integrated Commissioning Lead at NHS Shropshire, Telford and Wrekin. Thank you, Jackie.
Good morning, everybody. We're going to share the presentation. Jess, could you please put our presentation up, and I'll do next slide as we go along. I'm Jackie Robinson, I co-chair the Better Care Fund with Laura Tyler, so I'm the ICB half, and we produce quarterly reports and we produce quarterly data to submit. Those reports have been shared with the committee, and I know Councillor Bentek has taken a lot of time working with Laura and Jess to review the content within that. So thank you very much. The ask at the end of this meeting is for your approval to submit that. However, I understand at the last meeting there was a suggestion that'd be really useful for the committee to understand a little more about what the Better Care programme provides. So just a brief presentation really to kind of go through that, explain what a pool budget is, how we spend that money, how that performance is doing, what's our focus on that data, and if colleagues need to contact us, who's the best person to speak to. So we'll move on to the next slide, please. Can you hear me? Hello?
Yes, we can hear. Thank you.
Oh, sorry, it went off for a moment then. The Better Care Fund's allocated to each local authority that's got a responsibility for adult social care. It's part of a pool budget, so the NHS, in terms of the ICB and the local authorities, pool their budgets. We provide expenditure by service type, which will give you more information. We've got that performance metric, and the next slide I wanted to really go through is that pool budget. So there is a partnership agreement where the NHS and the local authorities contribute to a nationally determined amount for a single shared budget, and it's then used to commission or deliver health and social care services. The value in Shropshire is £50 million, so a really exceptionally big amount of money, and it's made up of three contributions. The NHS minimum contributions at 30.5 million and comes from our baseline funding. The local authorities is 15 million and comes from the LA's baseline funding plus discharge funding, which is expected to be spent on reducing hospital discharge delays. So you can see the connectivity between Vanessa's work and the work of Gareth that was presented earlier. And then the third part is the Disabled Facilities Grants, which is 4.5 million, which is paid to local authorities and ring fence for housing adaptations. And that's to enable people to stay well, really, and remain living it independently for as long as possible. I think the next slide will give us a bit more of detail and how that expenditure is broken down. What I can say is that each pool budget, each organisation may lead on various schemes, and there are 6 key areas of investment which I think you will find helpful to have demonstrated. So for proactive care, there's investments around prevention, advice and grants to third sectors. There's early help interventions. There's young persons counselling, which the BU service, the autism outreach and support groups, there's mental health social workers, there's social workers for frailty, again linking back into Vanessa's, there's colleagues who work in Alzheimer's, the support workers, personal care staff who work across primary care networks, and then across over to the adaptations, there's the home adaptations to the disabled facilities grant, and that can be a small adaptation, or it can be a really, a large, so it could be a walk-in shower, or it could be as small as, small handrails and other pieces of equipment to help people live independently. And then there's the community equipment loan service on top of that. The third area is carers, really important. Carers having a significant amount of pressure on them in terms of supporting their loved ones and keeping them at home safe. So there is a carer support service funding, and there's also a hospital-based carers lead link worker employed. Next slide, please. So the next slide's about prevention and hospital readmission. And there's OT, residential nursing care. There's a brokerage where we would talk to residential homes about getting people into the right beds and short-term work. There's the reablement start, which is short-term assessments. There's a number of social workers and community working teams. There are staff in the accidents and emergency and minor injuries pathway. The Red Cross have been funded, mental health crisis services funded. There's a service called 2 Carers in a Car, and there's a mental health crisis accommodation service. In terms of reducing the time in hospital, there are hospital social work teams to facilitate, and also the continuing healthcare assessments that take place. There's a Section 17 discharge liaison worker. There's a social worker in around immediate care services. There's a frailty assessment unit. There's therapy and nursing. There's end of life. There's a hospice. There's domiciliary care, and there's reablement. So again, linking that into the work that Gareth and Vanessa's sharing, you can see how the Better Care Fund really adds value and is joined up. In terms of reducing the need for longer term care, there's an organisation, Hope House Respite, that's also available. So how are we doing? Okay, so 2025 performance focused on the admission avoidance and effective discharge, and ensure that community interventions are effective and reduce the need for long-term care. Our performance is tracked nationally, and it's shared across the system through a dashboard. We have our own BI system in the ICB, who provides a lot of the data locally. So as a board, we're able to look and track how we're doing, and focusing on areas where perhaps it needs more performance or more data drilling down. There are 3 key areas really that are looking at. So there's emergency admissions to hospital. So that's around admissions for ambulatory care, falls related admissions, length of stay discharged, and the average number of days within that discharge. And then there's the long-term admissions to care home, and that's around the percentage of people discharged to their normal place of residence. And then there's a proportion of people who, after reablement, need no further ongoing care. And I think one of the things I wanted to bring out today was that locally, our data shown a really strong performance, with Q1 outturn of 78 people admitted to a residential and nursing care home against a target of 100 people. So really strong performance due to the success of implementing home first approach and start, and Shropshire's consistently coming in high in the national performance table for that. So I think, it's something to be really applauded in terms of the work that's going on out in the community. Next slide, please. So where are we going next? So we've got 2025-26 that focuses on using that data then to inform our future direction. So it's about setting those metrics moving forward, informing that planning, monitoring, reporting that progress locally and nationally, including the national BCF policy outcomes, and enabling that early action to be taken where performance could be off target. In regard to if colleagues want to find out more about this, by all means, you can speak to Laura Tyler, who's the Director of Commissioning from your local authority, or if you need to speak to our colleagues in the ICB, please contact myself or Jess Timmins. Jess is our operational manager that we fund to support Shropshire in that. So Jess is the person who does a great deal of work behind the scenes, pulling all that information together and to make sure that we put really robust reports in and that we manage our data effectively and use it to the best possible way to plan our services going forward. Thank you, Chair.
Thank you very much, Jackie. Obviously, a huge amount of work being done to ensure that people are discharged from hospital in the best possible condition they can be. Can I just ask you, do you have any idea of how much influence your activities are making on the delayed discharge metrics? And I know that other people in the room may be able to respond to that.
Yeah, I think the people in the room would probably be in a much better position. So I had a meeting actually with Gareth a couple of days ago, and we were talking about, you know, the connectivity. I'm not sure if colleagues wanted to come in on that, or Jess, you wanted to come in.
What I would say is it's really hard to, it has been really hard to judge other than anecdotally with local information because of the data flow from South. We've not had reliable data to look at the length of stay metric. That is resolved now, so from next month we'll have much more grasp of our performance and going forwards, and we'll actually be revising our metrics plan in line with the data we've now got.
Thank you very much for that. Anybody else want to comment on that particular point? Nigel.
I think what I would say, Chair, is that making sure that we safely discharge someone with complex needs from a hospital setting into the next correct place of support and treatment is itself complex and multifaceted. The work and the activities and the focus as part of the Better Care Fund is utterly fundamental. But so too, and Jackie mentioned in the slides there, the role of the Care Transfer Hub. That is pivotal. That is a collegiate, multi-agency service. It's got Shropshire Community, it's got South, it's got Robert Jones, because they have some facilities. There are local authorities, and that includes Powys, as well as other colleagues. So I don't think we can attribute necessarily the improvements or maintenance of key metrics on discharge of complex patients just to this. But what I would do is absolutely underline the importance of the work that we do jointly, the services that are provided, because that is utterly fundamental.
Thank you, Nigel. Anybody else got some input on that? And then I'll go to Ruth. No, Ruth.
Thank you, Jackie, for the presentation. I mean, it's really pleasing to see the data around care home admissions reduce, and I think that is a good step forward around supporting people more closely in their local communities and at home. So on that note, we are expanding the start offer into the community. There are currently a lot of social media adverts out there around recruiting new staff assistants, staff workers. So any shares on those would be really appreciated, because it's a challenging job. It's difficult to recruit. So that would be great. And also this sort of focus on, as we've discussed all morning, this focus on prevention feeds into this, and it's really important that we keep both messages in our minds and equally address both.
Thank you, Ruth. Any other questions or comments, Vanessa?
Councillor Bentek, can I just respond to Ruth?
Yep.
Ruth, if you'd like to send over the information to me, I can share it with our comms team. We've got a whole host of networks in terms of our comms that we can push that information out for you. Please send it over and we can help out.
Thank you. Vanessa.
So from the frailty perspective, linking it back to the strategy, home is the best place to prevent frailty with those services wrapped around people. And we know that the longer people are in hospital or in other bedded areas, the less likely that is to be the destination when they're older and frail. So just to put the evidence base really back under this and, you know, support Nigel really and what he said, it's complex. Not everybody can go directly home, but for those that can, we need to be making sure we've got the best services. We've got to keep them there and keep them well there for as long as we can.
Absolutely. Thank you very much. So the board is asked to note the BCF programme presentation and asked to approve the BCF 2025-26 Q1 template. So I'll propose that. Seconder. Thank you, Simon. And board members who vote in favour, and anyone against, and any abstentions. Thank you. And I need to announce my error in failing to ask the board to note the healthy ageing strategy, which is the previous document for 25-28, and that it fully aligns with both health and wellbeing strategies and SHIP and TWIP priorities. And so the board is asked to approve and support the healthy ageing strategy implementation. And I'll move that. Second, please. Thank you, Claire. And those in favour? Any against? And any abstentions? No. Thank you. That's unanimous. So can we then move on to the ICB update for information from Nigel Lee, Director of Strategy and Partnerships in SAF and Chief Strategy Officer at NHS Shropshire, Telford and Wrekin, and Claire Parker, Director of Strategy and Development at NHS STW. Thank you.
Thanks very much, Chair. I'll start off with a couple of bits and then hand over to Claire for a couple of others. We've done included in papers today the pack that is shared widely, and I think it's really important because it collates the key areas of update from a number of our different partners across our health and care system. I was just going to highlight a couple. The first one, obviously, just to reiterate, is that healthy ageing and frailty strategy. It is an important area, and I think it just you know, we are continuing to work both from system-wide groups, you know, our neighbourhood health implementation, and of course with our place-based partnership boards to really draw that together. I think the second one is you'll see some information there about primary care. You know, we talked about it when we talked about the you know, the system winter planning approach. Again, it's very easy to look at the headlines, which I'll come to in a second, and other partners, but it is really important to look at the work that has been done in general practice and other parts of pharmacy, optometry, dentistry, and it's really important to look at the improvements in performance and activity and access in that side. And I think just notably, one of the key initiatives for this year and a focus through general practice was about the use of what they call the National Advice and Guidance Service, and 100% of practices across Shropshire, Telford and Wrekin are signed up to that, which again is really important. I was going to mention two others, if I may. I think the first one is, if we just focus on SAF for a second, a number of people will have looked, I'm sure, at the national rankings which were published not so long back. It is, of course, a collation of a number of different performance metrics, but that in itself, it's still important. It's good to see some of those areas you know, continuing to improve, particularly around elective waiting times, diagnostics and performance on cancer. I know that Joe Williams, as Chief Exec, and the whole board are pleased with the improvements, but we absolutely recognise there is plenty to do in that side. But again, it was just to acknowledge that. Our community trust, I think, in the light of what Gareth was talking about with the winter plan, again, really well placed to look at what those alternatives to emergency department are. We talked about a range of those, but again, as part of a integrated system approach to what we're doing. I think the final one, Chair, from me before I hand over to Claire is just to publicise. I know it's now on the public website, but SATH and the Shropshire Community Trust are continuing to look at the plans to develop a shared leadership group model. There is a public board in common next Tuesday morning when we'll be both boards will have a chance to review that in more detail, obviously in public. So it was just to note that. Claire.
Thank you. Thank you, Nigel. Okay.
Thank you. The only piece of news to add to Nigel's update is that Shropshire have been successful in the National Neighbourhood Implementation Programme. So it's a really good opportunity here to say thank you to every partner that sits around this table to sign up to do that piece of work, because without all of you and the relationships and the strength of those relationships, I know Tanya and I talk about that all the time, we wouldn't have had a really strong bid to take forward. And that has been recognised by the national team, that those bids that have been chosen are where there's really good work happening in the neighbourhood sphere and building on those relationships. The work is starting at pace now. We've already had a deluge of information about how to take that forward. There will be a number of events that will be coming up to work together. I've already messaged Vanessa because we do have to pick some cohorts to represent within the neighbourhood implementation project, and I think frailty would be a really good way to start and look and accelerate that. The other opportunity for Shropshire particularly, and I know Ruth and Heather will be particularly pleased about that, is to look at rurality and how we deliver services in our neighbourhoods that are particularly vulnerable from a rural perspective. So there's some real opportunities around this, and we've got a national coach that will help and support us, and actually some national visibility of Shropshire as a place. So that's really good news.
Thank you very much, both. I think we all share the scepticism of national rankings, and I think we need to identify that the SATH and the other partners are improving on a daily basis, and we need to recognise the improvements and their dedication to achieve high quality services. So thank you. And the neighbourhood health services are, of course, a key part of the NHS 10-year plan, and we are very pleased to be at the forefront of that drive forward to improve the health of all in Shropshire and Telford and Wrekin. Thank you very much. Any questions on the update? No, thank you very much. And so if we can move on to Item 9, the pharmacy needs assessment. Presentation by Mark Trenfield, Senior Public Health Intelligence Analyst at Shropshire Council. Thank you. Thank you, Mark.
Thank you. As you'll be aware that I presented this at a previous board, so I'm just coming to you today for approval that the final report that I've put is acceptable and can be published formally. I can share some slides of the summary of the presentation if you wish.
Thank you.
So I will just share my screen. Here we go. Right, has that shared for you all?
Yes, thanks.
Thank you. Right, so this is just a brief update on the previous presentation that was produced last Health and Wellbeing Board. So as documented, we have a statutory duty to produce a health pharmaceutical needs assessment every 3 years. We have produced some previously. Previous one was produced in 2022. So following this report, we had a public consultation between the 27th of June and the 26th of August, and we must publish a final version by the 1st of August. So I have briefly outlined just here where our pharmacies are in Shropshire. As you can see, we have got the 17 dispensing practices shown on the left here, and then we have 43 community pharmacies shown on this map here, dotted around. And I have also, within the document, following the public consultation, I have plotted some of the other pharmacies that are near Shropshire as a result of some of the comments that we had. So when we did the public consultation, we had 39 responses from members of the public, and I produced a summary of those within the report. We also had 4 more responses from the ICB and the Community Pharmacy Shropshire Leads, which I've published in the report that you have, and I've made some amendments to the previous draft report as a result. And like I say, we must publish by the 1st of October 2025. So I'll just present the summary. Some of these are what I have presented before. So I've just documented that there are 43 community pharmacies, 17 dispensing practices within Shropshire. We found that nearly 90% of our residents are within a 10-minute car journey of Shropshire's community pharmacies. And as I've stated in the report, there are many localities that are supported by a GP practice that dispense medicines to their patients. And while that is a valuable resource for those patients, those pharmacies are not, or those GP practices are not able to produce the full services that a community pharmacy might. We have found that there's limited opening hours with particularly weekends and evenings. There seems to be a gap, particularly in the south of the county. And some of the services that pharmacies can offer, they seem to be held at most of the community pharmacies, but not all of them. And some of the activity is quite low. So in addition to previous, I found that there are 54 community pharmacies in other local authorities that in England that are within 5 kilometres of Shropshire. So that is in Telford and Wrekin, Cheshire, Hereford and Worcester, Staffordshire. We also have 7 pharmacies in Wales that are within 5 kilometres of Shropshire's border. So some of those pharmacies are open past 6 p.m. on a weekday and fill in that little gap that there was. Most of those are in Telford and Wrekin, and there's one that's in Cheshire. So we have more people per pharmacy in Shropshire than in England, and while the dispensing GP practices fill in that gap, as said before, they don't offer the full service. The number of pharmacies has dropped since the previous PNA. We have had over 6.5 million items prescribed by Shropshire GP practices, with nearly 300,000 coming from distance selling pharmacies. So we possibly might need to do a future assessment to see whether that increased use from distance selling pharmacies is due to patient's choice or whether there's unmet need. There's only one 100-hour pharmacy in Shropshire, as opposed to 3 in the previous PNA, and that pharmacy is in Oswestry. Some advanced and locally commissioned pharmacy services are only provided by a small number of pharmacies. And community pharmacies have taken on more roles as part of the pharmacy contract, such as Pharmacy First, which aims to take pressure off GPs and hospitals. So, noted the gaps in provision is in weekend and night access, limited particularly on Sundays, particularly in the south of the county. And another note that came up from the consultation was the fact that research has shown that there's large amounts of community pharmacies nationally were loss making. And while there has been changes to the community pharmacy funding that have helped, it is still a shortfall. And therefore, the effects of losing community pharmacy, particularly in a rural area, would be greater, particularly if there's no other community pharmacies nearby that would cover the slack. So that would put pressure on the GPs and the hospital services. I've expanded this to opportunities. So opportunities for improving the visibility of some services. It was highlighted that in the resident survey that there were some services that people didn't seem to know about. So it might be that higher visibility could get more activity in those. The contractor survey indicated that there was a willingness for some of the contractors that completed the survey to provide more services if they were commissioned. And in fact, there's been some services where more contractors have come on since the draft report was produced, which I've documented in an update. It might become necessary for more evaluation given the projected growth of the population in the future. So the recommendations from this P&A are to raise the visibility of some of the services produced by pharmacies to increase awareness and usage. And secondly, to consider the impacts of the healthcare transformation, particularly the 10-year health plan, which outlined community pharmacy's key role in the management of long-term conditions. So as such, there may need to be a period where pharmacy services impact is transformed within the future primary care and neighbourhood health, and therefore there might be an interim review necessary. So that is the final report. Provided that it's accepted by this board, then I intend to get this formally published so that we meet our deadline of the 1st of October 2025.
Thank you very much, Mark. You did identify that there were very few practices that were, very few pharmacies that were open out of hours. And is this going to form part of your recommendations with regard to trying to increase that availability?
I have made the point within the report, but obviously it is up to the powers that be to decide what they want from the pharmacy service.
Simon, have you got any comment? Thank you, Claire.
Thank you, Chair. It leads on from your point, actually. I do wonder, thinking about the provision and the out of hours, the extension of pharmacy hours, whether we are very specific about encouraging, just thinking about the neighbourhood conversation, we are involving community pharmacy and other primary care services in that, and actually being really open through the pharmaceutical needs assessment to extended hours and extended services, I think would be really, really helpful. And I think we need to be really clear about that in the pharmaceutical needs assessment.
Thank you very much. Thank you very much, Claire. And obviously very strongly support that. Any comments from the floor? No, well, thank you very much, Mark. And so the board is asked to approve this report and asked to raise the visibility of the new services offered by pharmacies to increase awareness and usage. The board is asked to consider the impact of healthcare transformation. The recently published 10-year health plan outlines community pharmacies' key role in the management of long-term conditions, prevention, and deeper integration into neighbourhood care teams. As such, there will be a period of transformation within the pharmaceutical provision, primary care and neighbourhood health, and it might be necessary for an interim review of services if necessary. And so I'm asking for approval of this presentation. So I'll move. Do we have a seconder, please? Thank you, Rachel. And those in favour? Any against? Any abstentions? Thank you. So that's unanimous. Thank you. Thank you very much. And thanks very much, Mark, for all the work you've done.
Thank you, Chair.
And so we move on now to the annual Director of Public Health report from Rachel Robinson.
Thank you, Chair. I'll keep this relatively brief. The report is in the pack for everybody's information. I have got a few slides, but I'm afraid to share it because I don't think it'll share.
Just try and work it on the screen and share it and slideshow it.
Okay, I'm not very technical. Apologies. around the kids. That's usually what happens. So it's obviously, as part of my statutory role, I have a duty to produce an annual report. The annual report is my commentary on the health of the population, and this report is no exception. This is purely focused on the health of the population, but particularly with a focus on neighbourhoods and our communities within Shropshire. That was planned purposely for two reasons. One, we've got a new administration, so it's really helpful for our members to have that information about their local communities around the health and wellbeing, because it's one of our statutory duties as a local authority. And obviously the second bit is very timely in terms of the 10-year plan, the work around neighbourhoods. Fortuitously, we've came to an end of a fantastic piece of work, which all colleagues, and I just want to put that on record, a huge thanks to everybody who's been involved in the GSNA process at Place, which we embarked on as a health and wellbeing board a few years ago now. It had a bit hamstrung by COVID and others in the middle, but the teams, in terms of the outreach team, Mark in terms of the data team, others have worked phenomenally hard to go out and engage with our communities, to collate all the information and to collate action plans to keep this work alive, which is really around making sure that we have that place-based focus. So that continuation builds really nicely into new administration and the work around neighbourhoods. So the report in itself is written with that in it. What it does is highlight some of the patterns of health and wellbeing across our communities, particularly some of the work around life expectancy and where we need to be focusing, making sure that that we as partners have a focus on the things that we really need to be focusing on for Shropshire. Particularly in here, you can see we do our usual RAG rating around where we need to focus our attention, and there's no suppliers really around children and young people being a highlight of our work, particularly that achieving, and we're going to have that 2.5-year attainment. That's something that we're all going to be really, really focusing on, which is positive. Also emergency admissions and the work we've been doing around infant mortality, which is obviously an indicator of many other things and all those modifiable risk factors, particularly that we've talked about. Diabetes, which we've committed to as a system, and mental health, and particularly making sure we get the levels of diagnosis, and of course health checks, another area that's really one of those prevention work strands that we can really focus on getting uptake up. And again, in some communities who may not normally take up health checks, but also some aren't always eligible, but that doesn't mean it's not a good intervention itself. And I think our workplace health checks and others show that it's a really important piece of work. So those are areas that we absolutely need to focus on. There's a lot of work going on those, but it's about keeping those in mind. The report also highlights work around life expectancy and highlights for the first time in England, male and female healthy life expectancy has started to decline. We knew COVID cost of living, we were going to see this happen, and it's happening. In Shropshire, we haven't seen quite that pattern. It's not been reflected particularly in men, but it certainly has in women. But it doesn't matter. This is an area we absolutely need to focus on and something we need to target. And we always talk about the importance of the wider determinants of health in terms of it's not just that 15% around people's health care that affects people's health and wellbeing outcomes, the wider determinants, and what this report highlights is some of those things that we can really focus on that will make a difference to healthy life expectancy to our residents. Circulatory disease, and then tobacco still in there. We don't talk about it probably enough, but that real focus there. Again, the next bit of the report really then brings together that huge work that's been done across our communities. And I'd like to set, I think for us, the GSNA, particularly the place-based GSNA, is the cornerstone of what will become our neighbourhood work. It builds into the risk stratification. It's there. There's been huge engagement, so more than 5,600 questionnaires, events that have been held in each community to develop those action plans collaboratively, and then that work continues. So Hannah, Amanda here, and other colleagues I know will be involved, but a massive, as I said, thank you, and Mark's on the screen. With such a small team, it's not a small undertaking, but I think you can see there the real trends that are around health and well-being. So yes, access to services is really important in Shropshire. We know the work around our children and young people, but mental health, transport, so as a new administration, how we think about some of those issues around transport and how we can lobby to improve transport, which is really important in our rural county. Crime and safety, no surprise, cost of living, so all the work we've been talking about, pushing those messages out, absolutely critical, and housing. All of these issues that we know are real concern and impact on the health and wellbeing of our population. So focusing on all of those areas collectively will help us to achieve better outcomes and financial sustainability for all of us. So it's really important. There's a bit in there around previous recommendations, just to show that, make sure we keep an eye on the progress. And then finally, the recommendations there for colleagues, they're not a surprise. but because these are the areas that we've been talking about for some time as a board, but I think are absolutely at the core for a rural county such as Shropshire about where we focus, that continued focus on neighbourhood working, that continued alignment piece that we do really well in Shropshire. So when we get the opportunities, we align our programmes of work, obviously being intelligence led, and I think there's further work to do. I know I've spoke to colleagues about this and including the chair, the co-chair, around how we get really much more rural data. So the GSNA helps us to do some of that, but how do we really get that granular understanding of rurality? And then that continuation as we do to work together as one Shropshire, particularly recognising the important role of our communities and voluntary sector and looking at how we can recognise that, resource that, etc. appropriately. So apologies, it's a bit of a rattle through. It's there for the board and hopefully provides useful insight and evidence that should be informing our decision making, our applications around grants and support moving forward.
Thank you very much, Rachel, for that very comprehensive report and all of the hard work that you've done to try to improve the well-being of the people of Shropshire. I have two questions or comments. Simon?
Thank you, Chair. Excuse me. Worked in a number of systems and seen a number of JSNAs and DPH reports over the years. As ever, just want to recognise and thank Rachel and the team. We've got a really strong public health team in Shropshire County Council. That makes a significant difference as a commissioner, as a health commissioner, and the support and the information and the intelligence, most importantly, that builds from this, that allows us to then take this into the work that we do, is just really important. So firstly, wanted to say thank you, wanted to recognise that, and please pass that on to the team and to colleagues. Recognise some around the table, but there'll be a wider team involved in this. I think the second bit, Chair, for me is that there's a really common theme, isn't there, that's come through when we talk about neighbourhoods, we talk about communities, and we talk about how do we work together in partnership to bring about improvements and change, and to have the evidence base and the intelligence that underpins that continually coming through in terms of the DPH and the JSNA is a really important check that we need to keep coming back to and just saying, are we working on the right areas? Are we having an impact? Whether that be BCF that we heard earlier, whether that be winter planning, whether it be healthy ageing, whichever part of the agenda we talk about, let's just make sure that we come back into that space. And I'm certainly going to take those recommendations into the work of the ICB, because I think it's just really helpful in a snapshot of 4, without it being a really long list that gets lost in the document, to come back and do just make sure that our work is based on the report that comes out, because if we're not doing that, then what are we doing as strategic commissioners in that space? So some reflections and thoughts rather than a question there, Chair.
Thank you, Simon. I'd like to echo those words and also extend them to the Integrated Care Board and all of the health partners in Shropshire, Telford and Wrekin for all the hard work that's done to try to improve the well-being and health of Shropshire, Telford and Wrekin residents. Tanya.
Thank you, Chair. To build on Simon's comments, a comprehensive and simple to read annual report, and I can't believe, Rachel, it's only been 4 years you've been a Director of Public Health. It feels like we've been on quite a journey as a system over the last 4 years when you think back over the last 4 years. This is an evidence-based document that is simple to read, and we know currently this government is working through its fair funding formula. This document highlights that we have deprivation in Shropshire. And I think it's upon all of us around this board around how we use this document next. If I can just bring board members to the section 2, where it highlights living in fuel poverty. So building on Jackie's comment earlier, living in fuel poverty, it's 13.1% England average, where in Shropshire, 18.9% of our population in Shropshire are living in fuel poverty. And then you build on that in terms of children living in relatively poverty. You know, Shropshire is now only 1% less than the England average. And I think it's a really strong message to those people that make decisions around funding for Shropshire, around busting the myth that Shropshire is a very wealthy county. And in fact, we do have a lot of deprivation. That is because of the rurality of Shropshire. I also love the way that we've built it in terms of neighbourhoods. And I think it's really easy for our professionals as well as our councillors to kind of pick out their areas in terms of understanding the true need of their particular areas. So a really well written document. Thank you, Rachel.
Thank you very much, Tanya. Any other comments? And so the board has asked for to approve the report, and the recommendations are that the board is asked to approve the report, and to note that the report includes several key recommendations aimed at improving health and wellbeing in Shropshire, namely place-based, neighbourhood and community working, renewing the commitment to local place plan and neighbourhood-based working to improve health and well-being, recognising the essential role communities play in delivering improved outcomes and shifting investment into services that support communities, including the voluntary and community sector. Alignment, assessing and aligning with the government's neighbourhood guidance and the current development within Shropshire around community hubs and JSNA intelligence to align future services and directives. Intelligence-led, improving the evidence base to understand and monitor rural outcomes, engaging with communities in developing and delivering community-led action plans, and with the emblem of One Shropshire, continuing to work together as one community of partners to serve Shropshire residents, enabling communities and the voluntary sector to take a central role in service developments. And so I move the report, and can I have a second, please? Simon, and then those in favour? Thank you. Any against? And any abstentions? That's unanimous. Thank you very much. There is an item of any other business, which is that health in all policies training is being offered to Hoskin Health and Wellbeing Board members. And Rachel, do you want to expand on this?
I think just this is free training that's been provided to us from the LGA, which is fantastic. Obviously, particularly with the new council and administration, one of the things that we looked at previously is around health in all policies. So how all of our policies, we understand the impacts that it could have on health and well-being, minimising the impact that it would have on creating and further inequalities. It's a really important approach to take as a whole approach to everything we do as organisations, but particularly from the council point of view, our health overview and scrutiny are very committed to making sure that we are doing this as an organisation. So this training is offered free to us. It's unfortunately very short time scales, but we hopefully might be able to provide some more later in the year. But it's there to just help people to understand what sort of things we'll be looking for, and how we can make sure that we are taking a health and all approach. So it's offered to HOSC members, it's also offered to the Health and Wellbeing Board members, and it's just there for information. Thank you.
Thanks very much, Rachel. And is there a link to any further information regarding this?
That's a good point. We'll get it circulated. I can get. Hopefully, you'll have had a diary invite, but we can make sure that we circulate that more broadly. It'll come from Sophie.
Thank you very much. Any comment around this, or should we move on? No. And so the SHIP update has been circulated, and this is just for information, and there is no need for discussion. All presentations will be circulated after this meeting, and so I'd like to thank everyone for their contributions today and call this meeting to an end. Thank you very much for a very useful and valuable session today. Thank you.